Dr. Andy Frey, you are a professor at the Kent School of Social Work at the University of Louisville and the co-author of Motivational Interviewing in Schools, Strategies for Engaging Parents, Teachers, and Students. What would you say are the biggest differences between using MI in a school setting versus a non-school setting?
A couple of things. First would be motivational interviewing is highly dependent on identifying target behaviors, and the target behaviors that we identify particularly with teachers and parents are quite different in a school setting than they are in non-school settings. And in non-school settings, I'm primarily referring to more psychotherapy and clinical counseling type settings. And so the target behaviors that we try to identify and focus on are not really well defined. There's not a ton of agreement with regard to what makes up good parenting practice and what makes up good teaching practices. And even if you are to agree on what makes up good practices, our ability to measure and provide quantitative feedback to people is much more complicated in school settings. For example, in substance abuse, they use a lot of assessments where they have measures of how often you drink, and they've got good stats with how that compares to the regular population. And or your drug alcohol level was 3 times the legal limit, and ask people what that means to them. We don't have great measures for capturing parenting practice and teacher practices and then feeding that information back. So that's something that is a little bit challenging. Also related to target behaviors, an issue that's very different in school settings than psychotherapy settings is that it's usually an indirect relationship. So we're usually receiving the referral problem is the child's behavior or academic performance. And as consultants, we're often interested in changing parent behavior and teacher behavior as a vehicle to change child behavior. But parents and teachers don't always come to us agreeing that it's their behavior that needs changing. And so it takes a lot of kind of finessing to get to a point with parents and teachers maintaining a good relationship and getting on agreement that there would be some benefit to changing parent and teacher behavior in an attempt to get towards child behavior. And last, another difference is expertise within school settings. There's a variety of people that are trying to pick up, people from a variety of disciplines are trying to pick up motivational interviewing and use it, and some have an educational background that puts them closer to that, particularly client-centered counseling techniques. And others have kind of come through the educational ranks and ended up in a consultation role as a specialist because they've been a good teacher, but might not have the foundational counseling skills that are required to pick up the practice fairly quickly. So that's a difference in a school setting, is that you've got a wider range of preliminary abilities for people trying to use it. And then finally, the time that we have with teachers and parents, it's very brief and not often scheduled. Unlike psychotherapy, we don't have teachers and parents don't come and want to sit down with us for 45 minutes or an hour. And so we're having to adapt the practice to be used in kind of on the fly and in informal settings and in much shorter periods of time. Those are some of the major issues.